My name is Tracy Zaslow. I'm a pediatric primary care sports medicine physician at Children's Hospital Los Angeles. I'm the medical director of the Sports Medicine Program at Children's Hospital Los Angeles and the director of the Sports Concussion Program at Children's Hospital Los Angeles.
So why is it so important for parents and coaches to pay attention to the physical and medical needs of these young athletes in addition to their sporting abilities?
Having parents and coaches involved in really preventing injury is the key. We in the office don't get to see the patients until they've usually had an injury. We get the rare patient that comes in for a preventative evaluation. So it's really up to the parents and the coaches to be educated on what injuries are, what common injuries are in a sport, for parents and coaches to be educated on what are signs and symptoms of injury, and to me, most importantly, for parents and coaches to be aware of how they can prevent injury. There are so many ways that with the right training, the right focus on age and developmentally appropriate training, that we can avoid most of the things we see in our office.
What are, let's say, the top couple tips that you have on ways to prevent getting some major injuries?
The top few ways I'd say to prevent injuries. Number one is learning the appropriate technique and learning it when they have the developmental abilities to do that technique. And it sounds so basic and common sense, but it's sometimes, as leaders of kids, we just want to push them to be at their best, but sometimes it's beyond their abilities. So really working to make sure that they learn that technique, that they implement it well, and with that, we'll see a lot less injury. A second is appropriate conditioning. So we see so many kids go out and they haven't been as active in any sort of organized sport, and they go and participate in hours on end of practice at a very high intensity without an appropriate ramp up. And that's when we see tons of injuries. There's research that shows that when kids jump from different levels, from middle school to high school, from high school to college, where intensity changes, that's where we see the most injury, especially overuse injury. And so again, a very preventable problem in the sense of just by doing appropriate conditioning and slowly ramping up, gradually increasing their activity, we can prevent a lot of these overuse injuries.
How have you seen the focus on this concern and this topic change, if at all, in the last decade or so in Los Angeles and beyond?
I think it's interesting watching how sports have changed, and I think that factors into how injuries and injury prevention has changed. Sports a couple decades ago, when I participated in junior high school sports, it was less intense. Most kids participated on their school teams. Club and travel teams were a new phenomenon, and now it's really gone to another level that most kids are playing on multiple teams for multiple sports. If they have the socioeconomic means, they have private coaches and extra training sessions, and so with this, it limits kids' ability to rest. Many kids also often specialize in sports early, so they become one-sport athletes very young, which leads to further problems. And so the push often comes from the parents who see some drive from their child and passion and skill level in a sport, but really keeping kids active in multiple sports through adolescence and allowing them to rest and have free play is one of the keys to preventing the injuries in the long term.
Fabulous. Is there any final thing you would like to add on this topic?
That's a good question. I'd say really just having the forum like we're having today, where bringing together partners from multiple levels of sports participation is the key to reforming sport and making changes in sport, not necessarily dramatic changes, but changes that will really improve the experience for kids so that they can participate in sports when they're young, but throughout the lifetime, that they're not getting burned out by adolescence, and that they really can enjoy sports and athletic participation through life.